Here's an interesting stat from this story. Cost of data breach 2023 is the report. 82% of breaches involved cloud data. Therefore,
Mm.
securing hybrid cloud environments is vital. It used to be very few organizations. Back when I was a CIO, 2011 through 16, essentially moving to the cloud was taboo because of security. But now it's really hard to find a healthcare CIO or a payer CIO who isn't moving some aspect of their environment to the cloud. But 82% of breaches involved cloud data. How is that? I assume that conversation is happening as well.
I think people made the assumption that if it's in the cloud, it's safe. That's a question that we ask our customers. If you're going to put things in the cloud, what is the most appropriate applications to be putting up there? We do offer a product that resides natively in the cloud. So we're talking about doing a hybrid solution that mitigates some of the risk as it relates to just the cloud native storage. But I think it's a question that people need to start asking and working with their infrastructure partners to ensure that where they're putting information up in the cloud, there are security protocols, especially for healthcare, as we know. A breach is the actual physical cost of restoring it, but then we talk about reputational costs. We had a number of folks in the industry we talked to. It's just all the bad press that they're getting after it, and that can have an impact on the revenue as it relates to patients not wanting to visit that healthcare organization, or if their EMR goes down and a medication gets administered that is inappropriate because they didn't have access to the electronic MAR, then what is the cost of that? That's the cost of a life. So I think the cost is not just the financial cost, and that's what people need to understand. And so whatever investments you're making into securing your data, it's what does it cost to not do that? That's the question, right? So when I used to sell software, we had a product that would do the bedside medication verification, and that thing flew off the shelf because if they could just save one person from a medication error, then what's the cost of that? It's priceless, essentially. So it's the same theory with the investment of protecting your data is you're protecting it. There's the actual physical cost, and then there's a larger cost. So that's what sites are grappling with these days.